Dr. Mariam Baqi, consultant dermatologist. She has an Arab board in dermatology, a fellow of Mount Sinai, New York in clinical dermatology, fellow of Mount Sinai, New York in aesthetic and non-surgical dermatology, a former head of Arab board training program at Ministry of Health, founder and clinical director of Nadara Center Skin Center, a member of many regional expert committees in dermatology, and a social media influencer and speaker in many regional and international conferences. Please, Dr. Mariam, you can start your presentation now.
Are we set? Can I just shoot it?
Yes.
Awesome, awesome. Okay. All right. I really feel privileged because it's the last to speak of this phase. It's really a challenging mission to catch the attention of audience by the end of the day. And the other thing is that I feel privileged because you allowed dermatology to be spoken about twice today. So that makes me extra special. Actually, my dear friend and colleague, Dr. Zainab Saleh, had briefed beautifully the journey of the Arab board in her lecture. So I'll try to complete what's after the Arab board. I'm going to speak, of course, about the Arab board a bit from my point of view as a former head of the training. And I hope that would add to the lecture of Zainab so we complete each other. Um, before starting my lecture, I don't know how many people are there. I don't know how many people are interested in dermatology, but what really should make you think about dermatology or any other specialty is the fact that you can speak passionately about it even after 10 or 15 years of doing the specialty. And here am I on a Saturday afternoon or Saturday evening, actually, talking passionately about dermatology. That's one reason why I did the right choice when I came to dermatology. So I'll be speaking in brief today. It's an uncasual talk, and I'll be happy to have your questions by the end. I'll talk about dermatology as a study and a career, and then I'll briefly board the Arab board from my point of view, requirements and the benefits, of course. And I'll talk a bit about the international fellowship program, my experience as an example. So you'll see lots of these slides for any dermatologist talking about their specialty because there is a lot of, lots of fun gathering discussion during our journey, and I really had fun training those smart people in Salmania Hospital before leaving. And a lot of people would describe our specialties. Some colleagues would describe it, dermatology, never mind, it's the cortisone specialty, or you guys the doctors of cortisone. And if my colleagues in surgery allow me to quote a very famous phrase, that a successful surgeon or a great surgeon is a surgeon who would know when not to cut or when not to use a knife. I would apply that on dermatology. A great dermatologist is actually a smart one who knows the diagnosis of the case in front of him, not only giving steroid or dispensing the patient because he has no clue. So you only use it once you know what's going in front of you. And actually, one of the aims why I happily participated for the second time in the career day is to make sure we have original, properly made dermatologists because I think the market is saturated with specialists and people who took a shortcut, not in Bahrain only. I'm talking about an international phenomena, and I'm going to tell you why. But we aim or we look forward to have more and more properly made, board certified and above dermatologists. So I actually see my specialty as this. I see it as a beautiful Sherlock Holmes like artistic based, color based specialty that has a lot of fun and a lot of art behind it. But art and taste and fun is not enough. It's a luxury thing. The basic thing is a lot of studying because all of you guys know dermatology has lots of complicated terminologies, classifications, blah, blah. And actually, you don't get exposed properly during the medical school to dermatology. I mean, during the clinical years, you would be studying gynecology, medicine, surgery, all of these specialties. But when it comes to dermatology, it's a tiny, teeny rotation that is 1 or 2 weeks. And I had the experience to teach both students, AGU and RCSI, and I can tell you both programs are not enough. And it all depends on the teacher's effort to try to give you the basic stuff in this short rotation. So basically, you're doing something brand new. You're coming to study something out of scratch from the zero. Okay, so that's what makes it more difficult and more challenging, actually. So let's have the reason why to choose dermatology. There's never a dull moment, never ever a dull moment since I started until today. Every day is a new story. And it's a perfect combo between medical and surgical skills. For those people or those doctors who really love surgery, but they don't want the lifestyle of a surgeon, and I'm pretty sure you had lots of good speakers talking about the lifestyle of a surgeon, uh, who still want a touch of that, but want a better social lifestyle, I think dermatology is an excellent choice. Maybe the practice in Bahrain is not the best example to give, but where I did my fellowship, for example, the States or any other um, countries like UK, Germany, if a patient had a basal cell carcinoma or a malignancy, or a patient needed a flap, they wouldn't go for a surgeon. The dermatologist itself would do that. If he was a specialized or subspecialty was surgical dermatology or Mohs surgery. So it's a beautiful combo if you wanted to mix dermatology and surgery at once by doing a subspecialty in the future in it. Also, the specialty is really, really techy, which makes it a lot of fun. I don't know where is my screen. I think Hassan, can you see my slides? Suddenly it just vanished from the screen. Oh, it's back again.
Yes, they are there.
Oh, it's back again. Okay. I told you there has to be a hustle with my slides, always like that. So, what makes it really unique is that the specialty is very techy and it makes the practice really fun. So, every other day you hear about a new machine, ultrasound based device. You hear about a radio frequency device, blah, blah, blah. And it makes it a lot of fun. And every day it's an evolving knowledge and evolving science. And to give you an example, just to be able to hold the probe of laser hair removal that is even used at salons in Bahrain, we used to study a textbook that spoke about the physics of laser. So it's a lot of fun, but behind that fun is a lot of study too, and a lot of physics. Okay, also dermatology is a window to all other basic sciences that you studied in med school. What I mean is that the skin is the biggest organ in your body, you know that for sure, and it gives you a lot of symptoms to diagnose a lot of internal diseases. I don't want to waste your time by telling you stories, but we had some of my smart residents who diagnosed cases of acromegaly, malignant melanomas, and many other serious conditions, and many other rare pediatric syndromes just by clinical manifestations on the skin. Patients were coming for other reasons. That acromegaly patient was coming for acneiform eruption. And by looking at the other manifestations, we could refer him for endocrinologists and we could save the life of the patient after an operation done to take the tumor from the brain. So it is the window for other basic sciences. So the aim is to be that dermatologist who masters all the basic information to keep your patient safe. This is the most important thing. You want the patient to be safe at your hands. You don't want to be one of those people practicing. You want to be the one practicing to gain the trust of the patients. Also, you have the opportunity to care for patients from all ages. You're not only stuck with pediatrics, you're not only like, for example, in geriatric subspecialties, you deal with older age group. For those people who want to see a bit of everything, this is the specialty. And of course, not to neglect the part that you have a better social life. You know, when I was in the internship years, I was so passionate about surgery. I actually did my elective in surgery, not in dermatology, and I had recommendation letters. I even traveled to the UAE and I did my elective there in surgery, surprisingly. And then I sat with some colleagues from surgery, senior colleagues, and I realized this is not the lifestyle I wanted. So I had to shift from surgery to another specialty. And then I chose dermatology eventually. And as someone who appreciates art and loves art and appreciates details and color, I love derma because it gives me the ability to utilize my artistic eyes and my creativity every single day. That's a very important factor. I'm not talking only about injectables or, aesthetic part of dermatology. Dermatology as a whole is a geometric shape and color based specialty. That's why I have lots of mnemonics and lots of descriptions. And of course, it's one of those cute specialities that people will come to you happy and leave even happier, especially if that was a one-shot visit to diagnose, excise, and treat, and the patient would leave very happy and comfortable. Now, talking a bit about the Arab board, I used to be the head of the Arab board training program in the Ministry of Health, and I had the honor and the pleasure of interviewing candidates every year, 2 years in a row for the subspecialty. And I can tell you, when it comes to us, I really get annoyed and pissed off when you are interested in dermatology and some other people will tell you, never mind, just prepare wasta and get that position. You don't have to prepare, you don't have to do anything. And I would majorly disagree. Of course, I'm not living in a la la land, and I know some other scenarios would happen. But talking about myself, when used to interview, we used to, you know, hint, or let me say hunt, the best candidates. And I can proudly say there's some great collection of amazing dermatologists under the making. There will be the rising stars in Bahrain soon, because we aim to select those smart people. In the lecture of Dr. Zainab, she mentioned you three important keys if you want to join dermatology. Let me tell you something. When I used to interview those people, some of them who are interns who finished their internship and then they stayed for a year or a two or even 3 years in the house, I used to ask them, what have you done in these 3 years to invest in yourself, to be a good candidate to join dermatology? Just give me a reason to choose you among the other 30 candidates. Some of them used to work in their free time in other hospitals to get paid. Some of them did online courses in aesthetic institutes or in cosmetic institutes, laser courses. And I used to conclude from that those people may be interested only in the aesthetic part, the money part of dermatology, which is not the real life. If you had that chance to stay in the house, as Dr. Zainab said, you could have done a case report, a literature review, a scientific piece that tells other people you are interested in the real body of dermatology and you are investing in yourself to be a real dermatologist. You can join these conferences that are online. And one of the benefits of the COVID situation, you can stay at the home, your comfort place, and attend those conferences and meeting and get certificates and learn a bit about dermatology. So that is really important to consider before saying I have no chance. My question to you, what have you done to be of more luck or of more chances to join the program? So Arab board program is a 4-year program, and the first year usually is a general rotation. We get to rotate. Um, in departments like plastic surgery, pediatrics, psychiatry, pathology, medicine, and even pathology, if I didn't mention that. And the second, the following 3 years are clinical rotations in the clinic itself. So you get to learn from your seniors and consultants. And during these 3 years, you need to do a research thesis, which is similar to the PhD. Um, this is exactly from the website of the Arab Board. You can go and read about it. The requirements, basically, you are a member from any Arab country and you're a graduate from one of those accredited medical schools with a license and a licensure license. And you have to be, the problem is that you have to be enrolled in one of the accredited approved centers. So, for example, this is the dilemma that happens. For example, in Salmania, there are 2 posts or 1 post, and people who apply are 30, for example. So 3 or 4 get to have a position. And then what happens to the rest? Some of them may go to other subspecialties, and some of them insist on being a dermatologist. I love that. Great. What are you going to do? Never take a shortcut. Never ever take a shortcut. Never be a specialist. Never take just a diploma or an online course, because it is really important to properly master the specialty. Now, I understand how strongly someone may be wanting that specialty, and that's amazing. Chase it, go behind it in a proper way. I'm talking about the Arab board because this is the board we used to offer in Bahrain. We soon may have the Saudi board. And there are other boards all around the world. American board, which is almost impossible to get with all the competition from the American citizens themselves. Canadian, more even difficult. And we have other boards or programs like the German or Jordanian or other boards. My point is never settle for something less than a board, because this is step number 1. And I'm going to mention that when we talk about the fellowship. So yes or no, shall we do a board or settle for something less? Well, even if the rules in my country, I'm not talking about Bahrain, I'm talking about generally, Even if the rules in my country would allow me to take a diploma that is 11 months, for example, and then I can come back and practice and open my private, I have the funding, I have the money and the place, my answer would still be no. Why? Because usually people look at this, it's an iceberg phenomenon, right? People look at the top of the mountain. They just want the money. Money, you can get it with any specialty, not only dermatology, because I don't know, it's a reputation that is well known about dermatologists, which I don't agree on. Okay, the fame, we will be immediately injecting. Everybody is so obsessed with the injection, okay? Immediately jumping to that part. What about the big part of the mountain down there? What about the Arab board exams? What about all the courses or the studies? I mean, you don't see the upper top and judge immediately. You have to go through the whole process. And trust me, you don't want to be one of those people. Here are two stories that happened in the last couple of months for me, dealing with some patients and referrals from other colleagues. This is a picture from a mole in the face of one of the patients. She actually was referred by a colleague, telling me that, Mariam, this lady is a young lady. I forget her age, maybe in the 30s. She saw a plastic surgeon and he told her, the mole that you developed over a couple of weeks is probably a malignancy and we need to excise this. He actually booked her for surgery. And I told him, you know what? The story doesn't make sense. Age, racial background, and the duration. Send her over. I'm going to sneak peek with the dermoscopy. And when we apply the dermoscopy, this can't get any more beautiful. A beautiful melanistic nevi, getting this beautiful monotonous. You know, we have criteria to decide whether I should rush to surgery or not. So I saved the patient. Take of this.
Perfect.
Can you hear me now?
Yes.
I don't know what happened. I told you.
Yes. Happens.
Twice every single lecture I give. As far as you can guys hear me, excellent. So I was talking about the fellowship
We
program.
have 5 more minutes.
Okay, all right.
Increase
Just
the
do that
time.
up immediately whenever I'm done. So I think these are the last few slides. So fellowship, yes or no? Lots of people were wondering, how did you go to the States without a USMLE exam? It's the requirement of the center. They accredited the Arab board. They didn't need another certificate. Maybe rules would change in the upcoming years. Always double check with your center. Lots of fun, lots of learning on the expense of time, financial commitments, missed lots of important occasions. Yes, but it's all worth it. Why? Because it's not a luxury, it's a must. If you basically look at this is from NHRA, from the rule book, and to be a consultant, which is for me the creme de la creme position for any medical student, wishing from day one in med school to be a consultant, right? So to be a consultant in a subspecialty, you're either certified in family medicine, Arab board certified, and then automatically with time you're going to be a consultant, or you have to have Arab board in one of those specialties like dermatology, followed by fellowship, either 1 year or 2 years. And by the way, this rule is subjected to change by Al-Majlis Al-A'la Al-Sahha. Watch out for that in the upcoming 1 or 2 years. So these 2 years, is it worth it, not worth it? Shall we go for a fellowship or not? Still, my answer is yes, to make it short. So pros or positives, it's a prestige. I'm not talking about overconfidence, being snobby all around. No, I'm talking about the medical confidence when you give an expert opinion to your patient. Plus, there are no limits for knowledge. We learn every day. I still learn from my colleagues. We still discuss things because نفس ما أنا أقول ما في هرم أعلى في الطب. We still learn every day. Of course, you get to be expert in a subspecialty. So when I did my 2 years, I did it all in psoriasis, and then I spent a whole year in injectables. Of course, you know, you're going to be a reference or a keynote speaker or an expert speaker because you spend a lot of time studying something at the expense of your years. And of course, you're going to make a beautiful network of connection with our colleagues from all around the world. And of course, you get outside your boundary, the comfort zone, and you get to manage situations, which makes you a more mature human and a physician. The picture on the right, this gentleman is my mentor, Jacob Levitt. These are 2 colleagues from Saudi Arabia. The gentleman is a Saudi board certified, and this beautiful colleague is from Kuwaiti board certified. And this is the head of our department in Mount Sinai, Dr. Mark Lebwell. And imagine you used to work with all those amazing doctors. Each doctor is like the the world famous specialist in a certain subspecialty. So imagine you have the luxury to work with all these people and master new skills you haven't mastered during your board years. Some pictures from our gathering with people from all the GCC and Eid. And that's a picture from my appointment in New York. Thank you very much. I'm proudly still within my time, Hassan. So if I have any questions, I'm more than happy to get it.
Please, whoever have any questions, they can raise it up. You might find the questions, doctor, in the chat.
Yes, let me chat. All right. Thank you very much, Dr. Mariam. You're welcome, Mona. Wala, poetic and inspiring. Oh, thank you, Wala. I'm happy that you found it useful. Zainab, thank you for attending. Isa Al-Banna, can you please repeat a bit before the fellowship slide when the sound was cut? I don't think we have time now. I hope I saw that earlier. I didn't know that there was no sound. Sorry for that. Khadija, but it stopped from the skin biopsy. I think I was muted for some time, but we caught up. صح, Hassan? We're okay now, right?
Yes, doctor.
Okay. All right. I don't see any questions. They're all thank yous. Very happy for you watching, guys. If you have any, I love dermatology. Thank you. So do I. You're welcome, guys. So if you have any more questions that pops up in your mind later, you have my Instagram. You can catch me on the direct or my email. I'll be more than happy to answer any question that can be informative. And thank you, Hassan, again for having me for the second time.
It's a pleasure, actually. It's an honor to have you with us on the Career Day. It added a lot to our thank you, doctor. Thank you so much. And I hope we meet up in further programs.
Inshallah.
Thank you so much.
Thank you very much.
Okay, guys. Now we'll be having a 5 minutes break. Then we will continue with Dr. Reem and Ansari.